My name is Tulika Rastogi, and I'm a Policy and Research Manager at the Canadian Federation of Humane Societies, or the CFHS, Canada's Voice for Animal Welfare. And I'd like to welcome all of you to the second webinar that we're running in conjunction with the CFHS's Accessible Spay Neuter project. Some of you may be aware of this project, but for those of you who aren't, I invite you to visit our website, cfhs.ca, and click on Animals in the Home and then Accessible Spay Neuter, where you will find a suite of tools to help individuals and organizations across Canada to advocate for and actually implement accessible sterilization services for companion animals in your communities. As part of this project, we've been hosting a series of webinars through the fall of 2014 to highlight real-world examples that are increasing accessible spay-neuter rates across Canada. So these are initiatives where organizations have taken the best practices about how to implement accessible programs and tailored them to the particular geographic and sociocultural context of the communities they're working in. So please check back on our website for details about upcoming sessions, as well as to view recordings of some of the past webinars. So now I'm really excited to introduce the presenters for today's webinar. We have today for you Ms. Nancy Larson and Mr. R.J. Baylott from the Alberta Spay Neuter Task Force. Nancy Larson is president and co-founder of the Alberta Spay Neuter Task Force. She has worked with First Nation communities and their companion animals for 15 years. She's a past board member of the Animal Rescue Foundation, or ARF, and has also coordinated a program for the Morley First Nation for Cochrane and Area Humane Society. Nancy, along with a friend, created the task force in 2008 in order to assist First Nation communities with managing their dog and cat overpopulation issues. R.J. Baylott is a co-founder and former board member of the Alberta Spay Neuter Task Force. In December 2013, R.J. resigned from the task force board in order to become the organization's operations manager. In 2008, R.J. was awarded by ISAW, the International Fund for Animal Welfare, their prestigious award for outstanding personal commitment. He has worked for a number of animal welfare organizations over the past 8 years. I'm particularly pleased that Nancy and RJ could be here today because I know that a lot of the information that we have out there about accessible spay neuter is really targeted more towards the urban and suburban context. But as we know, a large part of this country has to deal with the distinct challenges of remote and rural environments. So we're thrilled to be able to have Nancy and RJ present this perspective to you today. So for the sake of some logistics, I'll let you know that during the presentation, all participants, so all of the audience members, will be on mute. If you have any questions during the course of the presentation, you can type them into the question box in your GoToWebinar menu. And we'll hold all the questions until the end of the presentation and read them out at the end of the talk so that Nancy and RJ can address them at that time. So without further ado, I'll turn it over to Nancy and RJ, who will be speaking about a community-based solution for managing companion animal populations.
Great. Thank you so much for having us. We're quite excited to talk about the Spay Neuter Task Force, our history, and where we're going, and just about our day-to-day operations. So I'll start off with the slideshow here. Okay, so the Alberta Spay Neuter Task Force is an on-site, large-scale, community-based spay-neuter wellness clinic that operates in MASH style. Our goal is to improve safety and health of community members while also improving the health and well-being of dogs and cats. The Alberta Spay Neuter Task Force is a registered charity made up of a small working board, one employee as their operations manager, as well as a medical manager who is paid an honorarium. We rely on our many volunteers, which is the backbone of our organization. And this photo is Cheryl, who's now one of our volunteer technologists who travels to nearly all of our clinics. So when the Spay Neuter Task Force first started, our focus was simply animal welfare and spay neuter, but we quickly realized that it was a much larger scope. First Nation children suffer from an inordinate amount of dog bites. Deaths as a result of dog maulings occur on Canada's First Nations. An estimated 14 children have been mauled to death by dogs in these communities. When dogs are perceived as a threat to community members, they may not be treated humanely. We've encountered on several occasions children or adults in the community walking around with sticks to protect themselves from the large roaming packs of dogs. Dog calls are also not uncommon for First Nations. We hear about them on several occasions throughout Canada. Countless starving dogs roam First Nations, the result of unplanned pregnancies. And it's simply not possible to rescue the many dogs and cats in need. And we learned that from the very starting point, is that there's just so many animals that need to be rehomed, and it's just not practical. And community members appreciate assistance with owning pets responsibly. In the beginning, a few of our board members did a presentation to the ABVMA, the Alberta Veterinarian Medical Association, requesting their support to make provision for on-site clinics which could be held in communities that are experiencing pet overpopulation issues. We are very fortunate to have their support and work closely with them. And with that, the ABVMA has created a special license for organizations like ourselves. Therefore, for each clinic we have to apply for a temporary veterinarian facility license and follow their detailed guidelines in order to provide safe surgery for our patients. So at our beginning clinics, while we were waiting for the ABVMA's approval and also raising money for equipment, we held our first drive-to clinic in 2008. So we had volunteers drive to 12 vet clinics in central and southern Alberta with animals that we picked up in the community. The response was overwhelming. We anticipated to have about 12 to 20 animals, and we likely drove home that day with 60-plus animals in a small handful of vehicles. Spent most of the drive back privately calling every clinic in the province, begging them to fit in a few surgery spots. Therefore, the logistics were extremely complicated, and it was difficult to accommodate all the animals. We also held 2 clinics at the Red Vet Clinic close to one of the First Nations we were working in as a safety net. But we then again realized that it was just not as effective as we wanted to be and not able to be as large scale as we needed to be to make that visible difference in the community. So in 2010, and after fundraising for equipment, we held our first clinic on site on the Blood First Nation community, where we did 169 dogs and cats. So today, from the very beginning, we have increased our capacity to having 11 surgical tables operating at once and the ability to spay neuter over 435 dogs and cats in 2.5 days. All of the animals are sterilized, vaccinated, including rabies, treated for external and internal parasites, and tattooed for identification purposes. We have over $200,000 invested in equipment that includes 15 anesthetic machines and a fancy truck and trailer. The clinics are funded in whole or in part by the communities we work with. This is a very important fundamental to our organization as we feel strongly about community engagement and support. Other funding is obtained through private and corporate donations, fundraising events, sales of our logo items, grants, casinos, and work from rescue groups that we work with who work in the communities we visit. We are extremely fortunate in Alberta to have so many organizations working in various communities that by supporting our efforts, it helps decrease the numbers of unwanted puppies that end up in their organizations. Each clinic requires a ton of volunteers. We have 18 vets on average, 14 animal health technologists, and 110 general volunteers. On average, 2,800 volunteer hours are spent in planning before and afterwards of the clinic. The clinics are long 14-hour days, but they're extremely rewarding. Volunteer caterers purchase, prepare, and serve food for 100+ volunteers each day. We're extremely grateful for our kitchen manager, Beth, and all of her team who make sure that all of our volunteers are well fed, because the days you're on your feet for a long time, so the days get exhausting. So the clinic. So the spay neuter clinic season starts in March and runs into October. We generally start clinics Friday to Sunday, and we do about 8 clinics a year. Because most of the animals live outdoors, or the dogs live outdoors, we can't provide safe surgery in the colder months. That's why we limit our clinic seasons from March to October. This photo here is one of our longtime volunteer technicians. She comes to every one of our clinics. Her name is Connie. She's a psychologist, and she loves to have the kids engaged and to really keep them involved with the process. So community engagement. Funding from the community comes primarily from the health budget. It also has come from other departments of the community. We meet with leaders from each community in order to secure funding and a suitable site for the clinic. One of our largest struggles is finding the appropriate site, because we are often limited with resources depending on what they have in the community. We also meet in order to identify problem areas, such as schools where dogs tend to congregate and may pose a threat to students. We work with communities that have requested our assistance. So usually we'll get an email or a phone call from someone in the community who is concerned and wants to help. We have to decline invitations from new communities. Currently, we're getting upwards to 2 emails every few weeks from new communities that would like for us to come and help out. In many communities, the clinics need to be repeated in order to stabilize the dog population. So we feel it's very important that it's not a one-time solution, that we have a regular or more frequent presence in the community. But we have found that in smaller communities, the clinics are not needed as often after the one clinic, because the numbers are much smaller. Community members assist at the clinic and help from all areas of the clinic. We strongly encourage the community members to be involved, and we see a lot of the volunteers actually come back when we're back in their communities. For the communities that we don't go back to, we rely on the partnership that we have with the partner rescue organization to continue doing follow-up and assistance in those communities to ensure that the dog population isn't increasing. In this photo, one of the gentlemen named Daniel, he comes to every clinic. He makes sure that he's available when we come back to, he's in Saddle Lake, and every time we return, he makes sure that he's able to come and help all 3 days of the clinic. We encourage community members to ask questions, to ask their teams questions, to ask the veterinarians questions. Often this is the very first opportunity for some community members to have communication with a veterinarian. So it's great, an eye-opener for both the veterinarian and as well a community member. Yeah, this is Laura Lee. She's one of our directors, and she manages the front end of the clinic. We're also very lucky to have the support of the local First Nations police when available, and usually we'll have the support of most of the departments in the community where we're at. We are guided by the communities we work with and provide accessible veterinary care. Together we can create a better future for all. This is our truck and trailer that we put all of our equipment in. We're extremely grateful for one of our supporters to provide us with a truck and another supporter to help us with the trailer. We have a ton of equipment that we haul all over the province, and again, the logistics of trying to fill all that equipment in 30 different vehicles was very challenging, so we're much more efficient now that we have this trailer. So this first image is just the inside community hall or the school or wherever it is that we set up. This is basically what the overall part of the clinic looks like. So this is the initial part of the clinic setup. So you can imagine when we start, it's basically just an open ground hall, and then within half an hour and a half, we have this full-scale match-style operating clinic. Here's some more photos there. So a typical weekend begins with unloading our equipment, setting up surgery, and assembling over 400 crates. So getting ready for the clinic. So when we first pull up and we get into a venue, we have our director scope out the venue, and they mark each setup area. Then we have a director volunteer who directs all the traffic so people know where to unload all the equipment. Our cats are kept in a separate room, just obviously for basic reasons that we don't want dogs to stress out the cats, and of course for safety for the cats. Our volunteers have cared for upwards of 204 cats over one weekend. The cat room is often the most congested of the rooms because typically we put them in one of the bathrooms or two bathrooms, again depending on what space we have available. Cats are labeled on their cage with their intake tattoo number and given a red card for female or a blue card for male. It gives a fast visual for the medical team so that they know which animals are to be triaged. So on Friday, our team of volunteers go to targeted areas of the community to gather dogs and cats. And several of them have to be trapped. And most often when they have to be trapped, it's just because they're shy or they have very little handling from humans. So our volunteers like to take a slow approach and practice humane handling to avoid any undue stress on the animal. So the dispatch center is one of the first areas that we set up. And what we do is we get a map of the entire community. And we allocate teams to go to each area of the community. So when we do that, we have volunteers go door to door, which allows us to target the larger or shy animals that would otherwise not get into a clinic, as most of the dogs have never been in vehicles. Therefore, our volunteers are able to help them load the animals in kennels and transfer them down to the clinic. Some homes also have several animals, so it requires several trips and multiple volunteers and kennels. It also gives us a good understanding of what areas need to be addressed most in a community. When we return to those communities, we keep notes. Each team that goes out has a booklet with them with each house number on the map, and the volunteers to make notes. So if there's anything that they notice, so maybe there's a dog who recently had pups. So when we go back to our next clinic, we know to follow up at that home to ensure that those pups get fixed as well. Animals are also able to come in. We encourage owners to bring their animals in to the registration. Every animal gets a consent form, which basically covers all the basic animals information as well as the owner information. The consent form basically also goes over anything that the owner may have noticed, any possible medical issues, so that they could be addressed to the medical team. Every animal requires a signed consent form to ensure that the animal does belong to the particular guardian who brings them in. And the same applies for when we do roundup, when we're in the community. We ensure that we have a consent form from the guardian. When the animals are done being treated and spayed and neutered, then we have a volunteer who will call all the guardians to let them know their animals are ready to go. In some cases, we need to return the animal to the guardian. So at the beginning, we have detailed orientations that get sent out to, well, we send them out in an email beforehand, but we also do a formal orientation prior to the shift, and that's prior to every shift. So there can be several shifts in a day where volunteers are working different areas, The team leaders will provide the volunteers with an orientation to make sure that they're comfortable, and if they have any questions, we can go over them so it's not something through trial and error. So our responsible veterinarian for most of our clinics is Audrey Remedios. We're so lucky to have her. She's a board-certified surgeon who takes on the responsibility for most of our clinics. We need a vet. The responsible vet needs to sign our application for a temporary veterinary facility license, and she has been very instrumental in assisting with our protocols. Our medical manager is Jackie, and she's responsible for recruiting and scheduling vets, animal health technologists, and lay volunteers, ordering all the medications and disposables for each clinic, monitoring the flow of the clinic. As well, Jackie is an instructor at the Old College. Autoclaving the surgical pack area is a huge undertaking. Marion, who's seen in this photo, does all of the packs for us and has for all of our clinics. We have 6 autoclaves that run throughout the weekend, and it's several volunteer hours that are spent prepping equipment and during the clinic because of the volume of animals that we do. So the pre-anesthetic exams, when the animal gets registered at the intake, the animal then goes to pre-anesthetic exams. All animals are weighed and examined by a vet. Each animal is assigned a number that is also the animal's tattoo number, surgical record number, and crate number. The reason that we tattoo animals in the ear is it's a way for us to return animals to people if they go missing, because all of the tattoos are registered back to the owner. It also gives us an idea when we return to communities. We can see that, you know, a dog named Joe was spayed at one of our clinics 4 years ago. So it allows us to see that the dogs are staying in the communities for several years. They put on weight. They're doing extremely well. And it also is easier for our team of volunteers to recognize which dog has already been spayed so that we're not putting them under surgery when they've already been spayed. When we do the pre-anesthetic exams, the way they're set up also helps reduce the risk of cross-contamination, and the animal is assigned the same crate for the clinic for that same purpose. So if, during the exams, if they notice anything, the animal looks a bit off, then they can move them to a separate area of the clinic. The cat exams, of course, are done in a separate area. Again, just it would be so stressful on the cat to be out of a cage when there's several dogs around. In this photo here, you can see the kennels lying down. You'll notice flags on the kennels. We started doing that a couple of years ago, and it's been such a huge help to us for our operations because it gives us a clear indication of the animal's gender. We also use a red flag for dogs that may be a cautious dog or a dog that will bolt out of its kennel. We use a yellow flag for any animal that requires further medical attention. And then we use a green and an orange flag for animals that are relinquished animals that have been surrendered. We also provide grooming at the clinic. So you can see here some of the dogs that come in, especially the smaller dogs that obviously are not able to shed their coat like the larger shepherds or labs would. They get quite matted. So we have a team of volunteer groomers that come out to each of our clinics that help the dogs out. The sedation line. Dogs are sedated prior to prep. If the dog or the cat is feral or extremely nervous, the animal will often be sedated through the trap, just to, again, to avoid further stress to the animal. We use a combination of medications that we have found to work well for our clinics, which include pain management. This is a photo here of the prep area. So animals are prepped by technologists. They are shaved, induced, and intubated at these tables. The animals are tattooed here, and we stress to the technologists to put large tattoos that are very clear in the ear. Once prepped, they are carried to surgery, and all animals are monitored with a pulse oximeter in both prep and surgery. So here again is another photo of the prep. Prep tables each have a leader and an assistant, which is made up of all licensed animal health technologists. On to surgery. So you can see the surgery tables, they're all lined up. So like I said earlier, we have upwards, right now we're on average from 10 to 11 surgery tables. So when we have 11 surgery tables, then we'll usually have five or four prep tables. So it always depends on how many surgical tables we have, how many prep tables we'll set up. So now when the animal's done surgery, they get moved on to recovery. So an animal health technologist monitors this area. We strongly encourage the guardians of the animals to sit with their animal in recovery. We have volunteers with the animals who will rub their belly just to keep them stimulated once they recover. And then once they have recovered, then they get returned to their crate. We have electric warmers for the animals, as well as a blood pressure monitor and IV pump. You'll see in the recovery when we use a large floor space to recover animals, and you'll see several volunteers and several community members sitting with their dogs, and sometimes they're there for an hour, depending on how long it takes for the animal to come out of anesthetic. So discharge. We do keep some animals overnight or board them if necessary. In many cases, the animals are able to return later that evening. The roundup teams that went out on Friday, they return all their animals generally on Sunday. They return them to their guardians. Any animals requiring care due past surgical complications are sent to a local vet at our expense. Arrangements are made with local volunteers to ensure animals are driven to a nearby vet clinic if necessary. A volunteer calls owners of animals that have received more complicated surgery as follow-up. So those animals, again, generally have had a yellow flag on them, so we mark to ensure that they get follow-up after the procedure. I should mention, going back to when animals come in on intake, that we do triage animals depending on the availability of how many surgeons we have. So let's just say on a Friday, we typically like to get a lot of the females in, the larger females in, just so it gives them more time for recovery. So all animals go home with health records. They get a rabies tag with an aftercare instructions, including a 24-hour emergency contact number, as well as food. We go over the aftercare sheets, just to go over basic things, of course, like running and jumping and what things to pay attention for. The community members are incredibly grateful, and the response to our clinics has been very positive. We've made some incredibly great friends at the clinics, but what's most rewarding is when we return to a community and we're seeing the difference. Community members are telling us that seeing a difference. It's great. It's a feel-good for everyone involved. Another large component to our clinics is that we do end up with several, upwards of 200 surrendered animals over a weekend's time. So we do have a rescue group coordinator who contacts all the rescue groups prior to the clinic to see if they have a place to take in surrendered animals. Currently, we're working with about 30 reputable organizations throughout the province and neighboring provinces. Like I mentioned, we've taken upwards to 200 animals out of clinic. The animals must be transported sometimes from clinics to groups throughout the province to BC and Saskatchewan. When they go to the rescue organizations, the groups do spay neuter them and provide them with necessary veterinarian care before they rehome them. We do see a significant amount in parvo. Fortunately, over the years in the communities where we have had more of a regular presence, we are seeing a decline in parvo through our vaccine program. Several have medical issues that are treated prior to rehoming, so maybe let's say porcupine quills or maybe an injured leg. So all those things are cared for before the animal is put into a new home. So does it work? Well, we find absolutely it is working. The number of relinquished animals or stray cats that we receive at our clinics diminishes every time we return to a community. Teachers, RCMP members, health workers, community leaders have all noticed a reduction in dog bites, nuisance calls, and dog packs. There is a visible difference in the number of free-roaming dogs in the community, and the animal control facility in Wabasca, which is one of the communities we've been working in for several years, has noticed a significant significant reduction in impounded dogs. Many impounded dogs are tattooed, therefore we're able to reignite them with their owners. So sometimes the pound is completely empty, which is obviously our goal. So short-term versus long-term solution. So a community-based animal care and control program is very important to keep communities safe. A good animal care and control program should include animal care and control bylaws, dog bite prevention and animal care education, trained animal care and control officers to assist with removing problem dogs humanely, and relationships with local rescue groups or humane societies in order to house and rehome impounded animals. So what's next? Our winter months we always think are going to be much slower than our clinic months, but we find that's not the case. So for this winter we're doing a lot of housekeeping and just looking at all areas of operations, from board governance to clinic procedures, protocols, and things that we need to improve on and change. We are developing a more comprehensive education program that's going to be more community-focused and community-driven. We're also developing guidelines for an effective and humane animal care and control program for First Nation communities, while at the same time understanding that each community is going to be different and what may work in one community may not work in the next. We're hoping to increase our capacity and visit new communities. These are a few of our stats just to show how much we've grown over the past 3 years. So, our numbers over the last 2 years have basically doubled. Well, they've over doubled in some areas. So we're very lucky to be able to do 8 clinics a year at the volume we have been doing. Well, thank you. That's basically an overview of the Alberta Spay Neuter Task Force.
Thank you so much, RJ. Is there anything further on your presentation, or are you about ready to be able to answer some questions?
Yeah, we would love to be able to answer some questions.
Oh, that's fantastic. So I will ask Hillary, one of our CFHS organizers, to read out a question individually, and then you can answer.
Perfect.
So, just having some challenges finding them. One moment, please. Oh, here we go.
Okay, great. So our first question is, what types of fundraising works the best for your group?
What type of fundraising works best for our group?
Yes.
Well, right now we rely mostly on grants, is where most of the funding comes from, and of course the community. We've just in the process now kind of creating a fundraising team. So we do an annual fundraising event that generates some funds, but most of it is just through word of mouth and of course community support.
What do you classify as a smaller community, the numbers in terms of population?
The smallest community that we visit, the population is 3,000, and the largest is about 12,000.
Does the task force encourage the council to implement bylaws such as any new dog brought into the community must be up to date on vaccines and sterilized?
We're in the process right now of working with a pilot community, I guess you could say, because they've really wanted to work on some bylaws for the community that they hope would be effective. What we found is in that several communities who've tried to adopt bylaws, they haven't been effective because they don't usually have anyone to force them. Funding gets pulled from those areas, and there's usually a larger turnover. So it has been challenging, but it is something that we hope to work on right now. And again, we're looking at bylaws that will be really specific for the individual community. So for example, to have a bylaw for keeping dogs confined is going to be challenging because most communities don't have fences, and we don't want to encourage dogs to be chained. So we have to make sure that we're setting the community and the dog up both for success.
The next question is, are the feral females that are spayed just released after the clinic, or is there any time allotted for recovery, or is it just release and hope they'll be okay?
We do, if a dog is pregnant, in heat, or lactating, those surgeries are a bit more tricky. So we do keep those dogs overnight. The younger female dogs, treat them all as individuals, I guess. And so what we do is find out where the dog lives, if the owners are willing to keep them inside, if they have a warm place, that kind of thing. So every dog is treated as an individual.
And then regarding them being feral, if they are feral dogs, usually depends on, we use that term kind of loosely, I guess, because it depends on the dog, what the dog's behavior is truly like. In many cases, they will be able to be dogs that we can actually home and put with a partner organization. And the cases of a feral dog, a true feral dog that's been identified as a community dog, then we will spay the dog. Some cases we'll house them for several days with a partner organization in a kennel facility until we could release that dog back into the community, but ensuring that there is a caregiver in the community that is continuing to provide a food source and some makeshift shelter for the animal.
Yeah, and we don't release feral dogs. We only release dogs that appear to be doing well. Usually they live at a garbage dump. The people living around the dump are happy with them there. They're kind of become community dogs, and they like them. But their weight has to be good. They have to have a good coat, and they do have to have someone that will monitor them and call us if they're worried about the dog.
Great, thank you. So the next question is, how do you estimate the number of animals to be spayed or neutered? Is there an estimate from the community, or do you estimate based on the human population in the community?
We generally go off the human population, but it's kind of a hit and miss. When we first started, we would try to go out into each community and do almost a survey of the dogs in the townside areas. What's challenging is, again, because most dogs are free roaming, that dog A might be on, First Street on Monday, but then on Thursday the dog is, on 4th Street. So it's really challenging to identify, how many dogs for sure are in an area. But we do a drive-through before we do our clinics to kind of get an idea of dog numbers. But we basically anticipate that we'll be running our surgery tables the entire time we're there.
Okay, and the next question has to do with tattoo numbers. They're wondering if the number is accessible through a search, for example, at hospital.
Yeah, so basically we do, so in Alberta, the ABVMA assigned all veterinarian clinics with a combination. So for the task force, it's TF. And then every year, it's FN, I apologize. And then each year, the first letter changes. So this year was B. Next year would be C. So our tattoos would be BFN, followed by the number of, when it was spayed. And then that animal goes into the registry. So if one of our animals shows up at an impound facility or a veterinarian clinic, they could contact and we're able to provide them with the owner information.
So right now we have over 6,400 animals with our tattoo. So it's interesting where they end up. And but we are able to trace the owners. If an animal is impounded, we will pick the animal up before euthanasia. So we're really committed to all of these dogs and cats.
Okay, so someone was asking why you've chosen to tattoo instead of microchip. So does that answer that question as well?
Well, with microchipping, the logistics are really challenging because we have volunteers in several communities to our province. So to be able to have them, we would basically need to have hundreds of volunteers with wands while they're out in the community to see if they're chipped. But also, the tattoo provides kind of more of a visual. So when you're out on the ground, you're able to flip the ear and say, okay, that animal has been spayed already. We've in the past have encountered in some communities where they'll do a little bit of an ink on the incision site. It wouldn't really work for our organization simply, again, because it's hard for us then to identify the animal back to a particular guardian. So we have avoided using the microchips.
Yeah, the other thing is we send teams out into the community. So we have, on average, 6 teams that go out. Every one of those teams would have to have a chip reader and be able to get close enough to the dog to scan the dog for the chip. So we found that tattoos were easier. We've also found that a lot of these small impound facilities don't have chip readers, which is really unfortunate. So, and again, because we work in a lot of small communities with small animal control facilities, they're just not able to read chips, which is unfortunate.
Thank you. So next question, do you find you have many dogs or cats that need follow-up treatment days after the clinic has ended due to issues with their surgical site or other complications?
Surprisingly not. We have a very low incidence of reported post-surgical complications. So no, we don't get any. We don't get very many complications. What we do is err on the side of caution. So if anyone calls us and they're concerned about their dog or cat, we just immediately send them to a vet clinic. For anything, you know, we've sent them for a raise or burn or something like that. Sometimes they need a cone. But we do, if a dog or cat has had more complicated surgery, we track those animals and call the owners and just make sure that the animal is doing okay.
Great. So what vaccinations do you administer?
Yeah, so they've received a rabies vaccine, Germium 5 for dogs, and Filagard for cats. Rabies are on, we give the rabies vaccine to animals that are older than 4 months.
And with so many new communities contacting you, are you able to refer them to alternatives so they can get some sort of help until your group can come in and do a clinic?
We hope, we generally try to see if there is a partner rescue organization in the province that is doing work in that community or in that area that could assist a little bit, but right now, no, where unfortunately there isn't enough resources to provide for every community that's hoping for us to come out.
So what happens to the surrendered animals that you receive?
They all go to, so all the surrendered animals go to partner rescue organizations. And then once they go into those organizations, they generally go into foster home or into their shelter until they get treated and spayed and neutered, and then they get put into their adoption program. So all the animals that do get relinquished go to reputable organizations.
Okay, so those relinquished animals, are they spayed by your group, or is that done by the rescue group that agrees to take them in?
It's done by the rescue group who agrees to take them in. Sometimes there may be, 1 or 2 off dogs that end up being relinquished at the end of the clinic that were already spayed, but in most cases, when the animal is surrendered, it goes into a different area of the clinic, and then the rescue room coordinator or rescue group coordinator gets those dogs transported out to the various organizations.
Do you do SNAP, FIV, or FELK tests?
We don't know.
And someone's wondering if you have any plans to start doing winter clinics, or are they too risky for animals?
They would be too risky, especially with our climate, how cold it gets. Especially, again, because most of the animals live outdoors, we want to make sure the animals are recovered well enough to be back in an outdoor situation. So we don't do any, some of the groups that we partner with will bring in animals from the communities where we work, and they'll spay and neuter them and hold them in Calgary or Edmonton for a few days, sometimes a week, if not longer, and then return them. But for the Spay Neuter Task Force, we don't do surgery in the winter months.
Have you seen more of an animal control group come into play in the communities you've been to ensure the safety of animals in the community?
We have more of a support system now in the community, so that if there is a dog of concern or if they see an animal in distress, they'll reach out to us or one of the other rescue organizations. As far as something being developed, we see some communities who are reaching out now and asking us to be involved with those development plans. Again, one of the obstacles is that there's limitations with funding and just making sure they have the support system internally to fulfill those positions once they're created.
How do you decide on where to do a clinic? What if there is a great need in an area but the band will not agree? Are you able to assist an organization in the community?
We have to have all levels of support from the community. So we have to make sure that we're there because the community is really wanting us there. If a community a member reaches out to us and sends us an email and said, we're dealing with a large population of dogs, can you help us? In which case, usually we'll try to find out some other contacts in the community who we need to go to for funding and support. But right now, we have so many communities that are basically in our cycle that we're not able to take in any new communities. Last year, we weren't taking in any new communities, but we did throw in a community that was basically in crisis mode. They were announcing a very large-scale dog cull, and they wanted to look at a different approach than to, essentially, we were going to round up all the dogs and destroy most of them. So we did a presentation, Nancy and I, to Chief and Council, and they were immediately very much on board and supportive. So we did an emergency clinic, and we came in about 4 weeks later, and we feel like we made a very large impact. The community was much smaller, and I feel confident that we were able to sterilize upwards of 9+% of the animals.
Wow. Is there any community where your presence is no longer required?
There is a community where we've taken, there's been a few communities where we haven't returned to every year because we are noticing such a difference. What's exciting is when you start in a community and you do the drive through with a community member and you see, umpteen puppies on doorsteps and under porches, and then when you return 2 years later from doing clinics and you don't see those puppies, when you do, they're extremely rural, far and few. So yes, we have not had to return to some communities, but we still stay in communication with the community members to provide distant support. And if there's dogs in the interim that need aid, then we'll call on rescue groups in those areas.
Okay, so it looks like we have just one more question, and that's, is there a euthanasia policy?
Yes, so we do have a euthanasia policy, and typically the animals, we've been very fortunate that over the several years there's been very few animals that have had to be euthanized. The ones that are euthanized, it's a board-level decision involving the medical team and, of course, our medical manager. And it's usually the animals that there's no medical intervention that's able to help the animal. So if an animal comes into our clinic extremely ill and we cannot provide care for it at our clinic, we'll send a volunteer back to the next largest city that has a veterinarian clinic that is able to provide for that animal. So the few animals that we've had to euthanize are animals that there is no hope, usually a distemper pup that is so far gone or a parvo dog that's, moments away from passing.
Or hit by a car is a common one. But we've never had to euthanize because of behavioral issues. Even with the truly feral dogs, we've been able to find rescue groups to take them.
Amazing. Okay, so it looks like that was our last question. But we'll see, is there anyone else that has a question they'd like to ask? They can type it into the question section right now. Okay, it looks like that's the end of the questions for today.
Thanks so much, Hillary. And I want to take a moment to really thank you both, Nancy and RJ. It's hard not being in person to be able to offer you a token of our appreciation or something. But we are very grateful for you coming and being available to share your enormous experience and and expertise, and it's wonderful to see all the incredible logistics and organization skills that are, not just skills, but the capacity that you have to implement these incredible clinics and to see such amazing outcomes and rewards for that work. I'm hoping, as you said, that it will inspire others to take up the initiative and try and help out where there are gaps. You've mentioned that you're not able to always respond to all the requests that you receive, and so if other organizations are inspired to take up the gauntlet and help, that would be just amazing. So thank you so much. I also want to thank everybody in the audience for joining with us today. And for those of you who want to hear more about the Alberta Spay Neuter Task Force, I wanted to mention that we've posted a great video on the task force work on the CFHS's Accessible Spay Neuter website, and that's in the multimedia section. But you can also find it on the Alberta Spay Neuter Task Force website, I believe. Also on our website, you'll find details about our last webinar in this Accessible Spay Neuter series, which will be by Kitchener-Waterloo Humane Society on Tuesday, December 9th at 1 p.m. Eastern. So I hope everybody can join us for that. And I'll just check in, Nancy and RJ, any last words from you both?
Well, thank you for having us. You know, we're so excited to see that this is basically a growing movement in a sense, that people are realizing that, you know, spay, neuter, and humane education is so important for animal welfare and addressing, you know, the surplus of unwanted animals. So I'm glad that so many people have tuned in today to join us, and if there's anything you can provide support with, you know, people could send us an email through our site, and Nancy and myself would be thrilled to, you know, help where we can.
Thank you. Sorry, I was going to say that's very generous. Thank you so much for that offer. So if that's all, I think there's no other comments. I want to thank everybody today for your participation, and hope to see you again at another webinar. Thank you so much. Bye-bye.